successful surgeon. I wanted to be the head blood press. I wanted to be very skilled. I was cutting hair since I was 14 years old. So I knew I was really good with my hands. So I didn't want to just deliver babies. Right? People think that I go to the hospital and deliver babies. No, that's not it. Like, that's cool. I like delivering children. It's a happy time, but I wanted to be this very good surgeon. People didn't know that I had these skills with my hands, and I had these visions. But when I went to medical school, I was like, I'm gonna get everything that I could possibly get so I can get this skill, and then I can set myself above the rest, above everybody else. So, third year of medical school, you go on rotation. So after you finish all your classwork, your first and second year, you go into these rotations. And the rotations are basically you start to treat patients. You come out of the classroom and now you're in the hospital and you're actually seeing patients and taking care of patients. All right, so going for fast forward, I'm like, all right, I got to my surgery rotation. I don't want to be a general surgeon. I want to be an OB, but I'm a general surgeon. And that's where you get most of your surgery from. So this is where I'm like, all right, I'm gonna get these skills. So I'm like, all right, what do I need to do? I already knew that I had to be this much better, that I had to be the first one there, I got to be the last one to leave. I got to answer every question, I got to do everything above, because all the way up until this point, my reviews are different from my counterparts. They do the similar things that I do, they answer the same questions, they come late, but I can't do that. I can't. I get, we answer the same questions, get the same scores on the test, but I get the reviews that he needs to read more, or he might not be the best fit or the best physician moving forward. He doesn't have these skills. When I know all in my mind that it's a bias. So I'm in the surgery rotation. I'm in the surgery rotation. I'm saying, okay, I'm gonna eliminate all that. I'm gonna get up early in the morning. I'm gonna work. I'm gonna answer all of the questions. I'm gonna be neatly dressed. I'm gonna do what I need to do. And I get to this rotation, and it was, I'll never forget it. You have like a chief resident, and then you have an intern, and then you have like the medical school. The chief resident at the time, he was like this 53-year-old white guy. He used to be a pastor, and I'm just like, all right, well, if I get a fair shake, I get a fair shake from him. And so I knew something was wrong because just off the bat, he wouldn't talk to me. He would look at me. He would say anything to me. He would just look past me. And if he said anything, it'd be one or two words. Where did you get that feeling? So I said, okay, I'm gonna keep going. I went to the administration. I said, there may be a problem. They said, keep going. Don't worry about it. One day, we're in the operating room, and the job of the medical school student is to move patients. Move the patients, transport the patients, you pay your dues. So, as I'm trying to move this patient, he tells me, Pierre, this is the time where a small mind and a strong back come into play. So in other words, calling me a slave for the most part. And in my mind, that I'm not smart enough or good enough to be in this position. So I say that to say that that's just an instance of what you're gonna get. Don't nobody think that you're gonna make it. Don't nobody think that you're going to be in a position of prominence. The only person that can believe that and can make that happen is you.